Chapter 16 is about end-of-life issues, which can be a difficult subject for most people. It's important to remember that everyone dies. No one is immune to dying. Healthcare professionals struggle with all that they do for a patient, and the patient will still die. With all of the advances in medical treatment that we have, is it wrong for patients to choose not to be treated, even though they know they will die soon? Of course not. It is their choice. Sometimes people who have struggled with their health for a long time simply don't want to do it any longer. The chapter describes the physiological aspects of dying, the stages of grief as outlined by Elisabeth Kübler-Ross, and the history of hospice is also described. There is an in-depth study in the text about some famous cases of prolonged life by artificial means, which are the basis for all of the changes that we have seen in this area in the recent past. Many choices can be made when patients are seriously ill or terminal in their diagnosis. The example on page 232 shows how patients may try to make their wishes known. Sometimes, though, due to their conditions, it's not always possible to do as they wished. Important documents that can be helpful if the patients have thought or planned for their needs are the Advance Directive and the Durable Power of Attorney for Healthcare Decisions. Assisted death in several states has prompted other states to propose this legislation for its citizens. There are also several cases of patients moving to states where assisted death is legal because where they were living did not allow it. Brittany Maynard is a recent example of this. The Uniform Anatomical Gift Act lets your family know what your wishes are regarding organ donation when you die. Please consider it. The role of the healthcare professional in end-of-life issues should always be one of respecting the patient's wishes for their life and for their death.